Hi, welcome back. And I'm going to be reviewing insurance news today. And the reason why I do this is because the market has several factors at play, especially in today's environment, that could impact your insurance rates personally. And for you as a business owner, or if you're an HR professional, CFO, CEO, executive, this all will impact the company organization that you work for. And in today's article, we are looking at the uninsured rate. Now, first things first, this is not meant to be a political video. I want to dive in to these articles and this information to find out what is actually going on. And in today's political environment, it is becoming increasingly difficult to do so. So with that said, let's dive in and see what we can discover. So this first article is from Florida. And over the last couple of days, really since the debate, we have seen this huge spike, or at least I've seen this spike in articles related to the uninsured rate. And that is because some data came out of a federal database showing that uninsured rates were lower in the last couple of years. So this article is touching on that topic and speculating as to why this might be happening and tying it to the Medicaid purge. So let's get into it. Uninsured rate was stable in 2023, even as states' Medicaid purge began. So this is from the Florida News. Again, health insurance currently is under ACA, the Affordable Care Act, Obamacare, whichever term you want to use, they all mean the same thing. They are all synonymous with the same idea that all of these plans are subject to legislation that is federal. And it really doesn't matter too much which state you're in anymore if you are an individual or a small business. Pretty much the plans are very similar across all states as of today, post ACA. And again, yes, this is an anecdote looking at an article from Florida, but we are seeing these pop up all over the place. So let's get into it. Advocates have feared the unwinding would trigger a rise in the uninsured rate, but states, private insurers, and others launched intense efforts to ensure they did not experience gaps in coverage. The portion of Americans without health insurance remained stable in 2023, the Census Bureau reported on Tuesday, close to a record low the Biden administration achieved in 2022. Through expansion of public programs, including the Affordable Care Act. And part of this is because during COVID, we had stimulus packages that were released and limited the cost to those who enroll through the exchange, which means they get subsidies from the insurance companies. And those subsidies were increased and also capped at 8.5% of a person's income. That certainly helped. In addition, under the public health emergency, the open enrollment period was waived. So if a person wanted to enroll on health insurance, they did not have to wait. They could do so throughout the year. That is no longer in effect. So if you need health insurance now and it is not open enrollment, you likely would not be able to enroll unless you had a qualifying event, but I digress. About 8% of Americans were uninsured, a statistically significant increase of just 0.1 percentage point from a year earlier. But because the census survey's methodology, the findings likely don't capture the experience of tens of millions of Americans purged from Medicaid. So this is because this survey defined uninsured as someone who hadn't had insurance for a year. So because this purge happened in the middle of when this data was taken, they hadn't quite captured that population because they had been uninsured for possibly only 6 months, something like that. The findings likely don't capture the experience of tens of millions of Americans purged from the Medicaid rolls after the pandemic era protections expired in spring of 2023. Enrollment in Medicaid, the government health program for people with low incomes and disabilities, reached the highest level. Enrollment in Medicaid, which again is the government health plan that gives insurance to those with the lowest household incomes. They base it off of the percentage of the federal poverty level, FPL. And that is defined. There are household brackets for that based off of the number of people in your household. That was just before what's called the unwinding, the process states have used to disenroll people from the program after the federal government lifted a prohibition on culling enrollment. It isn't yet clear what effect the unwinding has had on insurance coverage, but the Census Bureau will release additional data on Thursday from a different survey that may refine the numbers. So we will stay up to date on this additional data that is going to be released to see how much this has changed and keep you updated on that. We are likely at a turning point. The director of the Center of Health Policy Research at George Washington University said, "We are about to change to a new season where things will be a little worse off from Medicaid unwinding." Medicaid unwinding has been completed in most states, and more than 25 million people have been disenrolled, according to the Kaiser Health Foundation, a health information nonprofit that includes KFF Health News. The census report, based on surveys conducted early this year, counts people as uninsured only if they lacked insurance for all of 2023, like I stated earlier, the entire year. So for an example, a person who was on Medicaid in April of 2023 before the unwinding began, then lost coverage and never regained it, would nevertheless be counted as insured for the entire year. Many people purged from Medicaid were successfully re-enrolled in or obtained other insurance such as Affordable Care Act, Marketplace, or job-based coverage. Others remained uninsured. I would imagine there's a decent population that remained uninsured. Advocates have feared the unwinding would trigger a rise in the uninsured rate as people struggle to find alternative coverage. But states, private health insurance carriers, and advocates launched intense efforts to contact enrollees by phone, email, social media, and ensure that they did not experience gaps in coverage. Still, because of the way the Census Bureau reports the uninsured rate, the full impact of the unwinding won't be known until the 2026 report. So one thing that happened for this population is that the necessity to be in an open enrollment period or a qualifying event period was waived for that year. I believe that has expired now, but that was one. Usually you only have 30 days, so if you lose coverage, you usually only have 30 days to enroll into a new plan. However, many markets, many exchange markets allowed the uninsured to come on that year without being in an open enrollment or within the 30-day qualifying event period. Beyond Medicaid, several other factors boosted the number of Americans with health insurance last year, including a strong economy and near record low unemployment. Most Americans obtained insurance through their jobs, according to the census, meaning that higher employment typically resulted in broader health coverage. Other key factors enhance federal subsidies that since 2021 helped lower the cost of private coverage through Obamacare. Signups for the Affordable Care Act marketplaces hit a record high of 20.8 million in 2024, according to a Treasury report that was released Tuesday. But that extra financial assistance is slated to expire at the end of 2025, setting up a flashpoint for whichever party controls power in Washington after the elections. Democrats want to extend the subsidies introduced during the pandemic, while Republicans want to let them go. Before Congress passed the ACA in 2010, the uninsured rate had been in double digits for decades. The rate fell steadily under President Obama, but reversed under President Donald Trump, only to come down again under Joe Biden. In addition to expand subsidies, the Biden administration increased advertising and the number of counselors available to help people sign up on plans at open enrollment. Also, contributing to the reduction in the number of uninsured are states' efforts to expand coverage to mostly low-income residents. North Carolina, for example, expanded Medicaid eligibility in December of 2023, resulting in more than 500,000 additional enrollees. Decades of research shows that expanded health coverage helps people individually and the public overall. Health insurance pays for routine care and can protect people from financial calamity because of severe injuries or illness. People who are uninsured are more likely to delay or avoid getting health care, which can lead to relatively minor problems becoming more severe and costly to treat. Having more people covered also means more patients can pay their bills, which can improve financial conditions. Health insurance data released annually by the Census Bureau is considered the most accurate picture of health coverage in the United States. The state-level uninsured data it plans to release Tuesday, based on a larger survey, counts people as uninsured if they don't have coverage at the time they were contacted. Thus, it is likely we'll be able to provide more insight. So we will keep an eye on that. And yes, I agree that the uninsured rate is extremely important data point, because the more uninsured we have, the more our hospitals have to bear for costs, the more the government usually has some costs on a state level. And the more uninsured we have, the less we have paying into a health insurance system, and the cost gets put on to only those who have a health insurance. So for example, let's say you have a group of 100 people, and 20 of those people are unhealthy and 80% of those people are healthy. If you are in a plan where you only have the 20 people insured and the 80 uninsured, that cost for that 20 is going to be astronomically higher, rather than just everyone sharing the costs out of that 100 people. The rule of large numbers is one to reference in mathematics and insurance. That is really one of the basic principles when calculating rates. Also, an adverse selection. So insurance companies want to drive away from adverse selection, meaning they want the number of healthy people, younger people, they want the demographics of that group to be usually below about 45, definitely below 50. And once those demographic numbers start creeping up, it does exponentially increase the rates year over year. So with that, thank you for reviewing this article with me. We will be keeping an eye out for this additional information that's supposed to be coming out in a couple of days. We'll certainly keep you posted. If you have any questions about the costs regarding your health plan, if you're an employer, HR manager, CEO, CFO, or other executive, there is a link down below to reach out and contact me to schedule a meeting. Thank you for hanging out until the end, and we'll see you next time.